Good afternoon, dear colleagues and dear patients. Today I want to talk about the treatment of heart failure after surgery of congenital heart defects. I published a YouTube video to this topic in German, and now I give you a preview on this topic in English. If we have no mortality data in the long-term follow-up after treatment of heart failure in adults with congenital heart disease, we need some surrogate parameters who indicate prognosis in this disease. Today, maximal oxygen uptake seems to be the most important surrogate parameter to predict prognosis in this disease. There are some ideas about the cause of heart failures in this patient. Most of all, we think that residual lesions or the ventricular function is the reason of heart failure in this patient. I think that we forget dysautonomia that may be very important for these patients. We agree that lifestyle and age have an important impact on prognosis in all these patients. And indeed, our study data clearly show that right ventricular or left ventricular function measured by MRI don't correlate with maximal oxygen uptake in these patients. These are the indicators for pulmonary valve replacement today. However, we clearly show a highly significant correlation between heart rate variability and maximal oxygen uptake in these patients. You see that the spectral analyzers with with high frequency power in green, low frequency power in red, and very low frequency power in gray decrease with decreasing maximal oxygen uptake and reach a very deep value about 20 milliliter per kilogram per minute. Furthermore, in this study, we clearly show that heart failure increase in all these defects with age, and age have a very important impact on prognosis in after surgery of congenital heart disease. Today, we have the data from more than 7,000 patients after pulmonary valve repairment in tetralogy of Fallot, and we see a significant mortality around 1% within the first 30 days, and the data of redo and mortality are shown in this graphical abstract. As expected, there is a unloading of the right ventricle with lower right ventricular and diastolic volume and a better right ventricular ejection fraction. There's a small decline in brain natriuretic peptide after this procedure. However, we see shorter QS duration that may indicate a lesser burden of arrhythmias, but we see no improvement of maximal oxygen uptake in this analysis. We clearly failed to show an improvement of maximal oxygen uptake in our study with the beta blocker bisoprolol. There are some data that indicate that sport may slightly improve maximal oxygen uptake and decrease an increased body mass index with sports. However, overall, there are disappointing results with all the therapies on the important parameter of maximal oxygen uptake. We failed to reach the endpoint with bisoprolol, enalapril, with percutaneous pulmonary valve replacement, surgical pulmonary valve replacement. We don't communicate A second endpoint that may be important for prognosis after bisoprolol therapy. In contrast to losartan, we have a lesser right ventricular and left ventricular hypertrophy after bisoprolol treatment. This may be an important advantage. However, there are many wide fields in the summary of the treatment of heart failure in adults with congenital heart disease. Looking to the pulmonary valve replacement, we have the significant acute mortality, but probably a better long-term outcome if we consider the conservative indication as shown in the slide. There seems to be a lower arrhythmic burden after pulmonary valve replacement together with a shorter QRS time. There's no improvement of maximal oxygen uptake. There's better natriuretic peptide and right ventricular function after pulmonary valve replacement. There are some data that show no improvement, maybe worse left ventricular function after the therapy. Our beta backup data show no improvement of maximal oxygen uptake, heart rate variability, right and left ventricular function. There seems to be a, a significant effect on left and right ventricular hypertrophy measured by MRI imaging. Some caution should be taken to the increase of natriuretic peptide after beta blocker treatment. The data about ATA1 antagonist ACE inhibitor sildenafil bosentan are very disappointing and show no effect in prospective studies. However, today the first data show a significant improvement after SGLT2 inhibitors with lower hospitalizations and the known data for mortality of the left ventricular uh, function trials. There seems to be a lower arrhythmic burden after this therapy in adults with congenital heart disease. We have no data about maximal oxygen uptake or heart rate variability, but we know the improvement from those patients with congestive heart failure and diabetes. We have an improvement of natriuretic peptide in adults with congenital heart disease and a better function of the systemic right ventricle in adults with congenital heart disease. We know the improvement of left ventricular function and hypertrophy from the trials of left ventricular dysfunction. That seems an improvement of performance measured by the maximal oxygen uptake after sports intervention. However, as shown in this slide, 80 to 100 patients of adults with congenital heart disease and heart failure receive these drugs in a current analysis that have no significant effect on the most important surrogate parameters. There are missing data about heart rate variability in the most intervention, although these data are simply and cheap to measure and will have a significant impact on prognosis. In the last 30 years, I'm very worried about that we don't have these data, and I'm very disappointed that the only data about heart failure in infants with congenital heart disease are generated in an investigator-initiated trial that was not supported by anybody. People explain me that the companies don't want to give money for prospective trials in patients with congenital heart disease, but perhaps we don't want to know this data. These are the data from the left ventricular dysfunction trials and heart failure uh, uh, and the cost calculation. And we see the cost to save a life in 10 years. We have very low cost for beta blockers, ACE inhibitors, and spironolactone. But we have very high cost for dapagliflozin that may be important for our patients, but we need the data. There are very high costs for defibrillators, mitral valve repair, and coronary bypass. Perhaps we don't want to know this important data in adults with congenital heart disease, but we needed to make good therapy for our patients. Thank you for your attention.